a story about a balance bill for some $30,000. The story begins as follows. When Susan Rakowski was hired as an English instructor at SUNY Orange last year, she was elated. After several years of unemployment, she and her husband, Michael Trust, had been eating through their savings and 401ks. Better yet, the job came with good health insurance through New York's Empire Plan and United Healthcare. They signed up. And she says, I thought we were out of hot water. And they were, until Trost, walking their dog one day, felt something in his heart, shortness of breath, and he was taken to an ER. Now, here are some calculations that they had to go through in those agonizing moments. Trost and Rosowski live in Dingman's Ferry on the easternmost edge of Pennsylvania. There was an emergency room in the nearby town of Milford, but Rosowski didn't think there were a network there. Another option was nearby urgent care center, but it was across the border in New Jersey, where Rosowski wasn't sure she was covered. So she opted for the bond-secure community hospital in Port Jervis, New York, the state where the couple's insurance plan was based. They got there, and she made sure the insurance was accepted. But can you imagine the calculations in a moment of crisis? Well, Trost, after some examination, had a failed mitral valve and would require surgery. So he had to be moved to another hospital in southern New York. And again, Rosowski asked, does my insurance cover? And it did. So on April 1, his heart was operated by Arthur Negg, a cardiac surgeon in Hackensack, New Jersey. Trost did well. Out of the hospital a week later, and the bills a few days later started to come. A few hundred for a hospitalist, a few hundred more for a urologist. Insurance pitched in. Rosowski wrote the checks for the rest. But then a surprise bill, $32,000 for the services of Dr. Negg, and the insurance was going to pay $4,000. What happened? The couple, the article says, had encountered what's known as a balance bill. The term for such a situation, many of you in the audience might know, in which an entire hospital stay or procedure is covered by insurance, but one of the specialists involved is out of network and bills the patient separately. Now, for me, the key in this story is the following. Rosowski says, Mike's life was in jeopardy. There was little time to think rationally. It would never have occurred to me to ask every individual, are you in my network?